Okay, so we are going to do introduction to basic tissues. Okay, so when you take a tissue is basically a collection of cells. They may not be identical, right? Not necessarily identical, but they are from the same origin. Okay, so origin means embryological origin. And also together, all these collection of cells will carry out a specific function. Okay, so tissue is basically a lot of cells which act together to perform a function, right? And actually, this is again the problem is, but remember that the tissue is definitely a functional unit of the body. We're not saying that it is the smallest functional unit, because then again that problem with the cell counts, right? But it is a functional unit of the body. And actually, tissues are not just cells, but they are made out of 3 components, right? So you have cells, fibers, and the matrix. Okay, so you have the matrix, which is we either call the ground substance also. We can call it the ground substance. And within that ground substance, you have embedded in the ground substance or the matrix, ground substance or the matrix is the same thing, right? Embedded in that, you get the cells and the fibers, right? So all tissues, these 3 components are there. They are in different percentages, in different forms. Okay, right? So coming from that, we talk about, sorry about this. Okay, so there are 4 different types of tissue. So all tissues in the human can be classed into these 4 types of tissues. Okay, and these are epithelia, connective or supportive tissue, muscles, and nerves. Right. So in the morning, you must have learned about the nervous system, introduction to nervous system. So you know about the nervous tissue now. Right. So today you learn about the epithelial tissue and connective tissue and muscle. Also, you will be learning. Right. So the 4 different types of tissues have the 3 components of a tissue in different aspects, amounts, and types that give all these tissues different features. Right. And they can function in different ways and control or do all the functions of the whole body together. Okay. Right. So then epithelia are the tissues that line or covers body cavities, surfaces, and different tubes. Okay. And epithelia mainly formed by tightly packed cells. Right. So the main component of epithelia are the cells. Okay. And then from the epithelia are derived the glands. They are divided into 2 types, the exocrine glands and the endocrine glands. So by invagination of the epithelia into the connective tissue which lies in underneath, you get development of glands. Okay, and then we have the connective or supportive tissue. So as the name indicates, these are tissues that provide structural and metabolic support to the other tissues, right? So the loose connective tissues that we see in the body are basically like packing material. Okay, so there are no gaps or spaces inside the body, inside the parenchyma of any tissue. Like if you take the liver, there are no gaps, right? So only lumens are there in the blood vessels or in a organ if there's a lumen in that particular organ, right? So all that is covered by epithelia, and inside you get packing material, which is the loose connective tissue. Okay, so between underneath epithelia, you get the loose connective tissues, right? And of course, you get capsules of the joints, tendons, and ligaments, which surround the joints and are linked to the bones and the muscles, right? And then, of course, the bone and cartilage are also considered as connective tissue, and they give structure to the whole human body. The main framework of the body is created by the bone and the cartilage, right? And blood is also a connective tissue, which is a liquid state and which helps in metabolic support to other tissues. And with the blood, you get lymphatic tissues as well, right? So lymphatic tissue is mainly involved in the immune system. Okay, so that is the loose connective tissue where you can see the fibers. So these are the fibers, these are the cells. Okay, and then this is the matrix. Matrix is, it doesn't have any feature in it. So we say it's amorphous. It doesn't show much character. It's just a sort of a plain area like, right? But it is full of different proteins. Okay. Right. So then you have adipose tissue, which is a type of connective tissue again, and it is, you find it underneath the skin, right? So when you do dissections, you will find yellow colored tissue, which is adipose tissue, which lies underneath the skin. It is basically a feature of the mammal, right? So all mammals have this adipose tissue, which helps again humans to live in different environments because they can conserve their temperature, conserve the energy, conserve the temperature, and live in different. It doesn't matter what the external temperature is, your internal temperature will be maintained, right? So adipose tissue forms an insulation underneath your skin, surrounding your organs, so that you can maintain that body temperature, right? And of course, it acts as a fat storage and also filling the gaps and sort of acting like a cushion for different organs. Right, so bone is the hard calcified tissue which gives structure to the whole of the body, right? And then similar to bone, cartilage is a firm tissue, right? So if you want to feel it, you can touch the tip of your nose. You see that the wings structure, you can move it, right? You can then, it will come back to its normal position, but you can move it, right? But if you touch your forehead, you feel the skull bone that is very hard. You can't move it or dent it or anything of that sort, right? So cartilage is partially flexible. So can you see it in the nose, ear, and the of course the articular cartilages, right? So those are the ones that the bones lining the cartilage which lines the bones is called the articular cartilage. So you will learn all these as you go along, right? Then of course you have muscles which have this ability to contract, right? So you have different types of muscles, and the specialized feature of those is that they can contract, right? So you have the three types of muscles: skeletal or striated muscle, smooth muscle, and cardiac muscle. Okay. Then of course nervous tissue, where the special property of excitation is seen, and you must have learned it in the morning. So you will have the neurons and the neuroglial cells in that tissue. Okay, so now you see that different tissues, the 4 different tissue types, are designed to perform different functions in the body. Okay, and then these different types of tissue come together in different forms to form the to make up organs, right? So several types of tissues come together in a specific manner to form an organ, and the organs may have one or more functions, right? So single organ, some of the organs will have like one function, like the heart, which has the function of pumping blood to all the organs, or have many functions like the liver. Okay, right? So lungs take oxygen, put out carbon dioxide, liver metabolize substances, and brain, we are supposed to use it to think actually. Okay, right. Okay, so just to show you how different tissue elements are arranged inside the organs, this is the gut wall cross section. So this part is formed by muscle. Okay, this part you have connective tissue, and this is basically the epithelium, right? And you can't see the nerves, but between these muscle cells you have those plexuses where you have outbar and what is the other one, myenteric plexus, right? So you have these plexus of nerves inside there. Okay, so all 4 tissue types are represented within that particular organ, right? So this is the gut wall. that this is actually the esophagus, right? So the whole thing is called the gut. Okay, so you have the epithelium. Underneath that, you have connective tissue, which we call the lamina propria. Okay, so the epithelium and the lamina propria together are known as the mucosa, right? So you have epithelium here, lamina propria here. So this whole thing is called the mucosa. Okay, and underneath the mucosa, you get the submucosa. Okay, submucosa, and then this is of course the muscle, right? Again, outside the gut wall, you again get some connective tissues. Okay, right. Okay, and then of course the organs come together to form the systems, right? So all throughout A levels, you must have learned about systems, right? So different systems and the different organs which are there for those systems and the functions of those systems, right? So that is called systematic anatomy, and we do learn that a little bit, but we learn mostly regional anatomy, right? So gross anatomy is mostly regional, but we will also learn systemic anatomy so that it's easy for you to understand it. Okay. All right. Okay, so then we'll now move to the topic that I'm supposed to do today, right? So we will talk about the epithelial tissues, right? So again, this is quite easy for you. You have done this and you can actually, because you know the concept, it's easy for you to understand it through understanding or just changing the language, okay? Okay, so what is the definition of epithelia? Epithelia is basically the tissues that line the free surfaces of the body, right? So the largest epithelium which we can see when we look at a person is the skin. Okay, so skin is the epithelium that is clearly visible to the outside and protects the whole of the body and sort of divides the body from the external environment, right? So skin has a large amount of the biggest function, the most important function, I should say, is the protection from the external environment, right? So if the skin is removed for some reason because of an injury or a burn or something like that, then the underlying tissues are exposed and they can get infected. Water can get, water will evaporate and the whole body is at risk. Okay, so the skin is extremely important. Okay, a tiny piece being scratched off won't matter, but large amounts of loss of skin can be actually can be deadly. Okay, and then of course you have the intestinal epithelium and the nasal epithelium, which also you can see if you examine your oral cavity and your nose. Those ones can also be seen, right? But the other epithelia are inside your body. Okay. Right. And also, as I said, epithelia lines the tissues, the outside, and also it lines body cavities, which we call the mesothelium, right? So like the pleura and the endocardium, okay, which is surrounding the heart and the body cavity, and also the peritoneum in the abdominal cavity. These are also epithelial structures, right? And we can call them mesothelium if they are very thin. Okay, and then they don't really have anything else. There's very little connective tissue and an epithelium. We can call that a mesothelium. Okay, right? And also it lines blood vessels and lymphatics. And in that instance, we call it the endothelium. Okay, endothelium. Right? So epithelia are basically avascular. Right? Avascular means there is no blood supply to the epithelium, right? So avascular is another word for not having any blood supply, right? So the epithelia is nourished, metabolically maintained by the underlying connective tissues, right? So connective tissues generally have a lot of blood vessels, okay? So epithelium is usually quite thin, right? The thickest epithelium would be the skin actually, right? Skin also again is nourished by the underlying tissues. So that is the reason, because through diffusion only these cells are nourished, and as you come towards the surface of the skin, most of the cells are dead, right? So when you scratch your skin, several of those cells will get, they will be shed. Okay. Right, so as we were talking about the function, so most importantly, protection, there will be a little bit of absorption and of course secretion of things like sweat and sebum, and also exchange of substances may happen, right? Of course, if the skin is wounded, you can, or scratched or damaged only, foreign bodies can get into the skin, right? Otherwise, it's difficult. Any bacteria, virus, fungus, anything can't really get into absolutely normal skin, right? So there has to be a slight cut or some other wound or a burn or something for anything to penetrate the skin and go in, okay? Right, so then we said that epithelia are formed by tightly packed cells. There is hardly any extracellular matrix, right? There is no spaces between these cells. You will have filaments and small cytoskeletal elements going from one cell to the other and tightly sort of binding them, but there's very little extracellular matrix between the cells, right? So they are tightly bound, their walls are tightly bound together by what we call cell junctions, okay? And these epithelial cells, as I said earlier, also show polarity, okay? So polarity means it has two sides. So if you take an epithelial cell, it will have two sides, it will always be like that, okay? So when it is developing, it gets the polarity, right? So the luminal surface or the basal surface, the luminal surface, which is towards the outside, okay? So if it's the skin, towards the environment, if it is the intestinal epithelium, towards the lumen, or the basal surface, which is attached to the basement membrane, okay? So basal surface rests on the basement membrane, and the luminal surface is facing the outside or towards the lumen. Okay, right. And then on these epithelial cells, you might find different specializations. Okay, so you will find tight junctions and different specializations in the epithelial cells. Okay, so then talking about the basement membrane is important because it is the boundary between the epithelium and the connective tissue, right? So whatever is superficial to the basement membrane is the epithelium, right? So above the basement membrane, you have the epithelium, and below the basement membrane, you have the connective tissue, okay? So epithelial cells cannot go beyond the level of the basement membrane. Okay, so if it does go beyond the basement membrane, that means there's something wrong, right? So actually in cancer, that is one of the things that a pathologist would look at, whether the basement membrane has been invaded, right? So if the epithelial cells have invaded into the connective tissue, gone beyond the basement membrane, that becomes abnormal, okay? So in a normal person, all the epithelial cells have to be superficial or above the basement membrane. Okay, right. So basement membrane produces extracellular support because it adheres to the cells as well as to the underlying tissues, right? And it provides an adhesion surface to the epithelia and to the connective tissue on either side, right? So superficially attaches the epithelium and prevents the epithelium from getting shed from the or separating out from the connective tissues. Okay, and the basement membrane is the one that is very important to control diffusion. Okay, so diffusion across the epithelium is controlled by the basement membrane. Okay, so basement membrane is not very easily visualized through light microscopy, but we can do special stains and see the basement membrane. Okay, so this line, this purple line is the basement membrane where you have used acid Schiff stain, periodic acid Schiff or PAS, okay, PAS stain to demonstrate the basement membrane. Okay, so the basement membrane has glycoproteins and that is what gets stained here. All right, so if it is not a special stain, we can't see the basement membrane in light microscopy, H&E sections. Okay, so you have to do a special stain to see it. Right, so if you look at through the electron microscope, then you see that the basement membrane has two elements. I mean, if you read books, it will give more details, right? So I'm giving you the absolute basic that is really necessary for you to know. Okay, so you have what is called the basal lamina. Okay, collagen filaments which are embedded in a matrix, and some membrane proteins. These will anchor this side of the basement membrane, will anchor the epithelial cells. Okay, and then the reticular lamina. Okay, reticulin fibers, which are again has a ground substance, they will connect to the basal lamina above and the connective tissues below. Right, so two layers. I mean, even the two layers are not visible here also, right? Even in electron micrography, but the two layers are there because the basement membrane attaches to the epithelium as well as to the connective tissue which is lying underneath. Okay, right, so then we'll talk a little bit about the cell junctions which are really necessary for cell adhesion. Right, so epithelium, you cannot have gaps in the epithelium because yeah, is there any problem? Someone trying to talk? Is there a problem? Okay, right. So we bind the cell junctions, bind each of the cells together, and they're found in mostly the epithelium. Of course, you find it in other cells also, but mostly it's really important for the epithelium. Okay, so these cell junctions are actually seen on the intercellular surfaces, right? So the two cell surfaces of the cells which are in contact with each other, that is where you find the cell junctions. Right, so these are the different cell junctions that we'll be talking about: the tight junctions or the occluding junctions, the adhering junctions, and the communication junctions. Right, so tight junctions won't allow anything to pass through them. Adherent junctions will adhere or fix the cell to the basement membrane and to the cells surrounding it. And the communication or gap junctions will help you to communicate with other epithelial cells. Okay. Right. So if you look at a tight junction or occluding or tight junction, you see them just underneath the luminal surface. Right. So immediately beneath the luminal surface or the apical surface, you find these tight junctions, and they form a collar-like thing surrounding the cells. Right. So nothing can actually get between the two cells. Okay. So like two collars, they are tightly joining these two cells together. Right? So if you look at this, it's like a stud. You put studs to connect two surfaces together, right? So these will prevent anything from getting into the cell between the, getting beyond the epithelium between the cells. Okay, so it will prevent. Now if you take the gut epithelium, the simple column cells of the gut epithelium has a very tight fixation surrounding it. So it prevents any leakage of acids or food particles leaking into the connective tissue underneath, right? So just imagine if the acid in the stomach started leaking in between the epithelial cells, right? So you'll have a big problem that is actually what we call stomach ulcers, right? So you have an ulcer or a big wound if that happens, right? So epithelium is very important in the gut, just like in the skin. Okay, so these are the tight junctions you can see in the gut. These are microvilli. Okay, so two cells and the tight junctions just underneath the luminal surface. Okay. Right, so again another picture to show you how the three-dimensional aspects of the tight junctions. Okay, so this is an electron micrograph. These two are the tight junctions, like the studs, right? You know what a stud is, right? When you put into a cuff link or a tie or something, right? So that is the junction here. Okay. Right, so then talking about adhering junctions. Now, these are different books will again give you different classifications, right? So don't worry about it. Just remember one classification. It would be easy if you remember this particular classification. You can go and look at your Vitas also. That also might have slight differences, but stick to one classification, right? Otherwise, you get confused. Okay. So adhering junctions, they generally fix each of the cells together and they are linked to the cytoskeletal